All right, good. So thanks for everyone for being here. And today we welcome Dr. Bazett-Jones from Sick Children Hospital, Sick Children in Toronto. And he's going to tell us today about apples. No, actually, no. About research misconduct and just a few bad apples. So it's obviously a very important topic, and we'd like this to be very interactive. We talked about it already, but really interactive. Ask any questions you want. You know, it's really, really important for the talk to be clear and that you get something out of it. And we'd like to thank you for being here. And
okay.
Go ahead.
Great, thank you. So thank you for inviting me. I'm supposed to stand here behind the podium because there's a camera pointing at me. I would much rather sit down and this be more informal. So, but hopefully you'll interrupt. If I touch any sore points or whatever, or something you're not sure of, please speak up. I'll tell you just a little bit about myself. It says here, Senior Scientist and Research Integrity Advisor. I'm a scientist. I don't know very much about research integrity. I was a associate chief of research at Sick Kids for a number of years, involved in faculty development. And in that role, some things came out about scientific misconduct. And I thought that this was really just a few bad apples, but realized in that job description that it wasn't. So I resigned from that post because I'd had enough. And one day the chief of research came to me and said, we need somebody at the Institute to take on the role of research integrity officer, and would you do it? And I thought, oh, I think I've had enough of that. And I thought, well, maybe it won't take up that much time. So, and you know, she was putting the pressure on, sitting there glaring at me. And I said, okay, I'll do it. And then she said, here's a file, I want you to look into it. So I was awarded right away with a job. So I'm learning about this as I go along. I'm not an expert. So some of you may know more about this than I do. The message I want to get across today is that doing research is full of gray areas, that there's no simple answer as we uncover data, as we try and interpret it, that there are lots of gray areas, and we don't always know what the right answer is. And this is true of lots of things in life, including ethics and research ethics and behavior. And you know what, I'm not a joke teller, but I know one joke, and it's about ethics. This young lad went to his father one day and said, Dad, what is ethics? And the dad thought, well, son, it's like this. Suppose a man comes into our shoe store and buys a pair of shoes, and he decides to pay cash for the shoes. So he hands me some money, and he doesn't realize that there are two $100 bills stuck together. So ethics is whether or not I should tell my partner. So the point is that we're always confronted with questions, and sometimes the right answer isn't obvious. Sometimes it is. Okay, so today I'm going to do at least two things, depending on how much discussion you guys get involved with. I went by the title of this. This is a PostDoc's seminar. So I'm going to focus on this part here of supervision, because as postdocs, you probably are currently involved in supervision, and hopefully you will be soon as you move on in your career development. But I'm going to talk about what people in the lab, students, postdocs, technicians, need to know about research integrity, and then how to supervise to minimize research misconduct, and then what is the institution's role that you find yourself in dealing with this. this topic. So what is research misconduct? Most of you know this person because his picture was in every newspaper in the world nearly a few years ago, and he was a famous scientist. Dr. Wong, as you know, was involved in human cloning, and he claimed that he had produced 11 embryonic stem cell clones from patients. It turned out, and these reports were in high-profile papers in Science. It wasn't surprising that he could produce 11 lines because the government of South Korea had given him enormous amounts of money. But in fact, 9 out of these 11 lines were fakes. They were actually from people in the lab and around, and not from patients. And so he got into a lot of trouble. That's a high-profile case. But if you go to the Office of Research Integrity website and look under here, misconduct findings, every month this is updated, and you can read stories about people you've never heard of who haven't hit the headlines of the major newspapers. And it's sobering reading, and it's everyday people like us, not world-renowned cloners. Postdocs, grad students, PIs. And at the bottom of each of these stories that you read here, it's by the month, there's some sort of sentence that's passed that's this individual, having fabricated and faked some images and so on, now can no longer apply for federal government funding for 3 years or 5 years or 10 years. Well, even 3 years, sort of a minimum sentence, that pretty well puts you out of commission, because if you're a postdoc or a new PI and you can't apply for federal funding for 3 years, you're pretty well finished. So these are really horrible stories, but they're extreme. They're what we call FFP in the business, which stands for fabrication, falsification, and plagiarism. And we could talk, for half an hour or more on what is plagiarism, because it's not as simple as you might think initially. Fabrication and falsification, pretty simple, making up data. I mean, who needs to collect data? You can just fill in some numbers on an Excel spreadsheet, or invent bands on gels, or wipe out bands on gels with really sophisticated digital processing now with Photoshop and so on. So that's definitely scientific misconduct. And if it was as simple as that, I wouldn't be interested in doing this job as research integrity advisor at SickKids, because it is just.
Can you make sure you're in front of the microphone for the
Yeah.
recording?
Okay. Yeah. Okay. Because it is just a few bad apples. People who don't need data but just make it up are probably sociopaths, and fortunately there aren't a lot of them, and there aren't any in this room. And so why am I here wasting your time? You weren't forced to come to this, were you? I mean, nobody said you have to come to this talk on research integrity. Maybe the administration said you should. I don't know. But it is just a few bad apples, except that that's not the whole story. It's much more complicated. It is the gray areas. It is the shoe store owner that doesn't know whether to tell this person or tell that person. That this is at one end of the extreme. And at the other end of this continuum is carelessness and ignorance. I didn't know that my data had to be a normal distribution to use this statistical test. Or I didn't know what that knob on the machine did. I know that when I turned it down, I got a good result. That's just ignorance. And then in the middle is this, what I've called bias or certainty. I don't mean bias in the good sense of the word. We're all biased. When you make a hypothesis, you have a bias. When you do an experiment, you think you know how the data is going to come out. You have some idea, but the bias, the negative bias here, the bad bias is where you're sure of the result. You ignore the result that you don't want, and you know the answer before you begin. That's, clearly not the way to do science. And so in this continuum, we can get trapped. So this person, Nick Stenick, has come up with these definitions. He has worked for the Office of Research Integrity. And to use new language, I think, is really important. Let's not talk so much about FFP, because those are the sociopaths, the bad apples. But talk about these other two terms: responsible conduct of research, the practice of scientific investigation with integrity. It involves the awareness and application of established professional norms and ethical principles in the performance of all activities related to scientific research. So that's a very positive statement. Questionable research practice is the opposite, is the negative of that. So responsible research conduct represents the ideal standard institutions and individuals endeavor to meet. FFP encompasses practices everyone agrees should be avoided. And QRP, again, in the spectrum, is in the middle. So what is responsible conduct of research? A lot of these things pertain not to students, or sometimes not even postdocs, but the head of the lab, the head of the institution in which you find yourself. So authorship, for example, is sometimes that as a trainee you might not be part of that discussion, at least initially, but responsible authorship is really one of the areas that people come off the rails over. Data integrity, that's definitely something that people in the lab doing the work from day to day are involved with. So how do you do that responsibly? How do you collect data and interpret it responsibly? Some of these other things, again, are related to your job as a PI, and as a postdoc, hopefully you're heading in that direction. The opposite is sometimes easier to define than the positive. So not retaining data or maintaining inadequate research records is questionable research practice. You don't intend to mislead, you want to do things right, but your notebook is a mess. You couldn't go back and reproduce your experiment from your notebook if you tried. Data is not kept for 5 years or 7 years, or it's not in a form that anyone could understand if you left the lab and someone had to resurrect this data and interpret it. Other things related to people at the bench using inappropriate statistical methods, for example, is questionable research practice. You don't intend to deceive, but you're in fact using the wrong statistical test. It's meaningless, and you don't know that, maybe. Or you do, but this test gives a better result than that one. So QRP, it's not outright fabrication or falsification, but it is questionable. So misleading statistics or graphics. We use Photoshop routinely in many applications now. Are you using all of the controls properly? That is a huge question, and we could spend 2 hours talking about how to deal with two-dimensional matrices called images. Lots of problems there, and I'll come back to that. And misrepresenting speculations as facts. So these are areas that are really difficult. There often isn't a clear-cut answer as to how we proceed, and that's where endless discussion and debate amongst yourselves, amongst your team, is required so that the right answer is, we asymptote towards the right answer over time. Poor supervision of staff is questionable research practice. And in fact, at SickKids, we define questionable research practice now as research misconduct. It's defined that way in the policy document. It doesn't mean that every questionable research practice leads to an investigation and booting someone out of the institute. No, but in fact, these things are examples of research misconduct. Yep.
Yeah, I have a question for the Office of Research Integrity. Is it a U.S. governmental entity? And if so, is there a Canadian equivalent for that?
It is a U.S. government entity. The ORI, it was initially at NIH. I think it's broader now in its mandate. It's in the Department of Public Health in the U.S. government. And it really is the gold standard internationally for how to do this. So it is something that many countries look to as guidance. And in fact, that website has lots of wonderful resources on it. Is there an equivalent in Canada? No. A few years ago, the Canadian Research Integrity Council held a workshop in Ottawa and said, what should we do about this? That many organizations, research institutes, universities, the private sector, so pharma and biotech companies, wanted something. So this organization called CRIC, which isn't a great name for a research integrity, sounds like crook, but got together and they've recently released a policy that the tri-councils are going to be part of, and it will probably develop into a resource similar to the ORI, only much smaller, to help institutions normalize their research integrity activities, how to normalize when something goes wrong, how to carry out an investigation or an inquiry, and a library of resources. So it's very informal and it's still being developed. So the answer really is no, there isn't. According to the ORI and the NIH, if an institution holds grants, federal US grants, then they must have a research integrity officer, the institution. So that would apply to McGill or maybe this institution, that there has to be somebody named who can serve in that role. So it does pertain to Canada, for sure.
Just for your interest, that person at McGill is Abe Feeks, the former dean of medicine. So he's including for us.
Right, okay. So let's return to this question. Is this an issue? And I wouldn't be doing this if I didn't think it was. And I was actually converted 4 years ago when I went to this CRIC meeting and heard a couple of speakers who presented some of these facts that I'm going to show you here. First of all, the PubMed retractions is 0.02%. And these are retractions based on either FFP or questionable research practices. Now that's not a very big number, but people who work in this field say that the discovery rate is about 1 in 10. So that puts this to 0.2%, which now I think is worrying. You know, 2 papers out of 1,000, 1 out of 500. That's serious because how many papers do you read a year? At least 500. That means, you know, one of the papers you've read is definitely off the rails. But it's probably worse than that. The Journal of Cell Biology, and this was, they reported this in 2005. I don't know what the current numbers are, but they haven't gone down amongst the journals. If you speak to journal editors, this continues to be a huge problem. All the journals are reporting this. 1% of the papers rejected because of image manipulation. So Journal Cell Biology, lots of images. So this is where this journal finds its problems, is in images. 1% rejected because of the intention to mislead. And a quarter of the papers are of accepted manuscripts are sent back for revision based on, or rejection, based on images that have been doctored inappropriately. So not necessarily to mislead, but just you can't do that. This is a really big problem with images. So just while I'm on the topic of images, if you do microscopy or record Western blots and whatever, you must save all images. You must save raw data. And preferably the date is in the name of the image so that we know when it was collected and on what instrument and so on. Then you can use appropriate image processing software. Some of the software that's in Photoshop, not all of it. But you can contrast enhance. You can do things that are appropriate. As I said, we could spend a couple of hours just talking about that. And you save the processed image. And then you save what you pull out of that and put into a figure. So everything is saved and archived. Very, very important. Because if JCB says, we want to see your raw data, that the reviewer is not very happy with figure 4A, you can show everything. And you will be asked to show everything. And if you don't have the raw data that came right out of the microscope, say goodbye to your paper at JCB. So that's an aside. But it's maybe even worse than that 1% or 25%. Because if something comes to light to a reviewer or an editor or a research and integrity advisor, you can't always tell whether something was done to mislead or whether it's carelessness. You don't know. And especially if you don't have the raw data, if it's been lost or purposefully lost, whatever. There's no way of telling. So only the researcher knows for sure whether the truth has been told. So I think there's a whole lot of people, maybe they've lost their grants or they've got bored with science and they go on to study research integrity as a discipline. No, I'm being facetious. There are good reasons to study this seriously as a sociologist or as a science sociologist. Lots of self-reporting studies have been done. And this last one here in 2009 is actually a meta-study of, I think it's about 30 self-reporting studies in the literature. So it's brought all of this together and analyzed it. So that's a very interesting paper if you want to read it. And I'm going to leave this talk with you so you can look up these papers. So what are these self-reporting studies? Well, they ask questions. So it's anonymous. You can answer these questions and not be identified and lose your grants or be booted out of your graduate studies. But asking a question like this, have you ever falsified research data? And if you ask that question, the answer is about 0.3%. This is one study, or this is from this meta-analysis. If you ask the question, have you ever modified results to improve the outcome, it can go up to as high as 5%. And that's pretty sobering, even if it's not as bad as that, 10 times lower than that. These numbers are startling and make us, are sobering, and we need to think. Have you ever had personal knowledge of colleagues who falsified or altered research data? So this is much easier to answer because it's not about me. It's about the guy down the hall. And yep, 5 to 30%. I know of something bad that happened down the hall, and nobody wants to talk about it, but it's pretty prevalent. Another study, Titus et al., their conclusions from thousands of these surveys that they send out, 9% of respondents had witnessed some form of scientific misconduct in the past 3 years. So it could be QRP, it could be FFP, but that's a startlingly high number. They estimate 3 incidents per year per 100 researchers. So how many people are there? Lady Davis? How many PIs? That number would start to show up in an institute like this. It certainly does at SickKids. A significant number. And the startling thing is that 37% of what they discovered in this paper were not reported to the NIH, or the ORI, which is required by law for the institute to report. So a real problem. So besides the numbers and the statistics, there were in these studies there are lots of, you can write comments besides checking off boxes of what you did or didn't do, and the comments are really insightful, and I think they can touch a nerve in all of us, because we realize that research is difficult and it's full of gray areas. So look at this. I think that FFP is a really small part. So just a few bad apples, right? I think those kinds of ethical issues we actually don't deal with very often. I think that whoever wrote this is right. I hope they are. But there are a lot of daily things that go on, and the person didn't finish the sentence, ... So that's the questionable research practice that whoever wrote this is aware of. And then sort of a scenario here which is not atypical. You can't reproduce the gorgeous data that you got last year. You did it many, many times last year, and now a year later, with the papers gone out for review and come back, and the editor wants you to do this experiment one more time, maybe in a slightly different way, and damn it, you can't reproduce it. So you bundle up the data that you had sent initially off to a journal, and you send it to another journal, and it gets published. But you couldn't reproduce it today if you wanted to. So is that right? Was it wrong a year ago, as this person asks? No. If it had been gone straight into press, it would have been all over with, and you'd never even know, maybe, that you couldn't reproduce it again. So, but what do you do today? Dad, what is research ethics? We could discuss that scenario. And then this is about, if you're a graduate student, it's about your supervisor. He's really famous, and you think he's ethical, but he never sits down and looks at my notebook, never looks at the raw data, just wants me to publish papers and to come up with beautiful figures for the papers. That person's supervisor is committing questionable research practice, and in fact is guilty of research misconduct. And that's probably not an uncommon critique to make. Okay, so if you're a graduate student or a postdoc or a technician, you might feel pressure to cheat. And it can come from two directions. It can come from yourself, that you want to please the boss. And you really need the paper, and so does the boss, because the grant's got to be renewed this year. And it can come from the other direction, that you've repeated the experiment, it's not fitting the hypothesis, you know you're right, you've done it every which way, and your supervisor thinks you're an idiot. What do you do? So if your tendency is to please. Remember that it's better to surprise yourself and surprise the boss rather than to come up with what you think is going to please. And that in fact the result that surprises is usually the more valuable result than the one you were expecting. So if this happens, you've got to speak to somebody. If the pressure's coming from the supervisor, obviously if you have spoken to the supervisor or feel free to and it's going nowhere, then you've got to go higher up the chain. But definitely it has to be dealt with. And then what do you do if you observe it across the bay in the lab or at the desk next to you or down the hall? Then you must report it. And silence is not an option. We'll come back to this reporting. What do you report and what don't you? Because you could spend all your time being a policeman and not get any work done. Okay, so that's if you're at the bench doing the work and confronting yourself and your boss with data. But as you move through your research career, you're going to be in supervisory positions. And even as a graduate student, you may be supervising an undergrad. And as a postdoc, you are probably taking on supervisory roles within the team. And so how do you mentor and how do you create an environment that's going to minimize these bad things that can happen? And then as you go on and either in academia or in industry, to create a research environment that gets the best results, not the ones that you are hoping for. So how can you minimize research misconduct by your role as a supervisor? In the current research enterprise, a lot of supervisors are supervisors. They're training staff to get data. And I really hate the expression trainee as applied to students and postdocs, because that's often what it is, what you are, trainees. And you're not trainees, you're students, you're in educational programs, and you're not pairs of hands learning how to do technical things. Hopefully you're becoming, as a graduate student, a philosopher and somebody who's got a broader view of the world. So it's really important that we don't train, and that's a very low bar. And that's where I think a lot of problems can arise, is because we don't have a vision that is trying to get at something that's more profound than just some data for a high-profile paper so we can get a grant. So the big vision. And if you are doing this, I think already the tone is set for minimizing, not completely eliminating, but minimizing, definitely minimizing FFP and questionable research practice. So be a mentor in a grand scheme of things, as opposed to treating people as technicians. The Socratic principle of self-criticism is absolutely key to doing good science. The unexamined life isn't worth living, he said. Well, the unexamined notebook isn't worth keeping around. The unexamined data, the unexamined hypothesis is not going to be very valuable. So everything, questioned. The gray areas are constantly being brought into the light. That it isn't a perfect business that we're doing. You do 3 experiments. They all 3 different, not repeating an experiment 3 times, but 3 different approaches. They all tell you that the hypothesis is on track. And the 4th approach completely contradicts the other three. What do you do with that fourth approach? Ignore it, bury it, publish your three experiments and get on with it. That's a question that we all have to deal with all the time. So in your team, let's talk about it. What do we do with that? Let's get it out into the open and not pretend it doesn't exist. It's that kind of activity that is really critical. So discussing the gray areas all the time. And talking about misconduct, it's something that we don't want to talk about. It's uncomfortable. And yet, if students and technicians know that there is such a thing as research misconduct, that there are rules in our program, in our team, that we're to abide by, how we use software, how we do statistics, and that these are laws and rules. In jurisprudence, that's called the expressive function of law. That in society, just knowing that there is a law about something improves behavior. So knowing that there is such a thing as research misconduct and that it is dealt with through laws and rules and consequences improves everyone's behavior. So we can't talk about it enough. And this, at SickKids we have seminars regularly for postdocs and graduate students. Everyone in programs at SickKids must attend one of these during their time at SickKids. And this is not an uncommon comment that we get after these seminars. This person, I've been in 6 different labs since an undergrad, and no one has raised the issue of research integrity. It's never been discussed. So let's talk about it all the time. As you set up your own lab, you might want to have a sign-off agreement on protocols, that everybody who uses Photoshop, these are the controls you can use. This is what you can do. This is what you can't do. Don't change the gamma function when you're improving contrast and brightness. Don't do that. So we all agree not to change the gamma unless the instrument that we got the image from says use this gamma. Okay, you might not know what I'm talking about, but it's everyone agrees to it. In your research, depending on what it is, there's always a statistical test that is standard. The others are not applicable to the kind of data that you collect. We all agree to use that one and not the other. So signing off on common protocols that your team uses is probably a good idea. And it really is building a team. So in group meetings, in team meetings, in lab meetings, let's get all the data out on the table. PowerPoint is really, can be the enemy of what we're doing. Because it's so easy to cut out a region of a Western blot, ignore what came above and came below, and put it on the table, and that is the data. No, it's not. What about the bands that you are not showing us? You know, and PowerPoint allows that to go on. So raw data, raw files. If you have images, for example, bring the raw TIFF files that came out of the CCD. Sure, you can bring the contrast enhanced and the PowerPoints, figures, and so on, but have the raw data there so that everyone can look at it. And so lab notebooks should be things that are open and really accessible all the time in a group. For supervisory committee meetings within the university, in Toronto, and I don't know what it's like at McGill, but graduate students have committee meetings once or twice a year. and they bring beautiful PowerPoint presentations, and the committee sits around listening to a wonderful polished talk for 20 minutes. And in fact, on the piece of paper that the committee has to fill out for the student, it says presentation, outstanding, excellent, satisfactory, and so on. And I think when I get to that question, this is inappropriate. This isn't a student seminar. This is a committee meeting. So let's throw away the PowerPoint. Let's bring out the Western blots and the raw images and the statistics from the patient samples and whatever, and let's look at the raw data. And we don't want a polished presentation. So as you supervise and are involved in this process, what kinds of things are you going to look for as students present their data? Polished presentations are really getting at the heart of things. And the more that the data is put out and examined and scrutinized, the less chance that there's going to be questionable research practice or cheating. And this gets back to where we were earlier, to say what you mean. Get me this data. This is our hypothesis. Here's the experiment. This is what it's going to show, and then we publish our paper. Well, what if it isn't that way? And so don't say, get me that result, because you quite likely will get it. And that might not be a good thing. So surprise me rather than please me, and reward the person in your group that kills your favorite hypothesis. Not negatively reward, celebrate their result in the group meeting. Praise it because we're now on track, and we weren't before with our favorite hypothesis. So, and again, the unexpected result is usually the most valuable. Getting notebooks out into the open is really, really important. You should be looking at the notebooks of the people you're supervising. If you're postdoc supervising graduate students or undergrads, their notebooks are not private property. It's part of the lab. They should be accessible. This is a question. We can treat it as rhetorical, but would or should a student be upset if you as a supervisor, if that student found you looking through his or her notebook, in the lab? Should the student be upset? Well, maybe it depends on how you communicate with the person, but that is public domain. That is something that should be accessible. So there are cultural differences in this business, and some people come to you as a supervisor thinking you as a hierarchical person, that you're way up there and you need to be revered, and that what you say is true, and there's an authoritarian way of managing your lab, that you tell people what to do and what kind of data to get, or the students expect you to, as opposed to collaborative. So those kinds of roles can influence what kind of data you're going to get. So watch out for inappropriate leadership styles, or people who think that you need to be pleased. And some people have trouble confronting and questioning the supervisor. So if you've been implying that this is the right answer, though really, deep in your heart you want the right answer, and you aren't really wedded to that idea, but people get the impression that you are, And if this person thinks that it's wrong to question the supervisor, then you're going to get the answer that that person thinks you want. So these are things to watch out for. Archiving data and notebooks is really important. As I said before, if something is raised down the road, somebody is uncomfortable with figure 4b in a paper you published 2 years ago, and you can't find the raw data, you're finished. You're in real trouble. So everything has to be archived, and that's something that is a real challenge now, because we probably should be moving to e-notebooks and other ways of, and depending on the kind of research that you do, the data can be very complicated, and how to archive it is a problem. But that has to be something that you work on. So as you move on and establish your own research programs, it really is building a team where collaboration, where getting the raw data out onto the table is really important, that people are constantly looking at each other's raw data and talking about the problems all the time. So what happens, even now, if you're a graduate student and your colleague next to you has left out the outliers, in this histogram, and leaving out the outliers gives a very nice, significant result, and including them doesn't. So what do? You're part of a team. You know what the data was because you saw the raw data and you saw the polished version with the outliers gone. So you say to the person, I think we should include those outliers. And the person says, yeah, I guess we should. So back in they go, and all is fine. And here's why we need to include the outliers. You can't remove them in this case because of this statistical principle. That's an educational thing. That is something that should be going on all the time. You don't rush off to the chief of research and say, I discovered somebody doing QRP, they need to be removed. No, it's an educational process, and as a supervisor, that's what you're teaching your students and technicians to do. If it becomes a routine thing, and clearly there is an intent to deceive always coming from this person, then you have a problem you have to take to a higher level. But you're a team and you want to talk about the gray areas all the time. Okay, so reporting is not an option, and there are lots of reasons for not reporting, and these are pressures that you will feel if you see this happening around you. You don't want to make a false accusation. Maybe you're mistaken. Maybe there's another explanation for what you perceive to be happening. It's a lot of wasted time, you might think, that it means committing time to this investigation and taking away from research. Retaliation. Are you protected by whistleblower protection within your institution? Can the person you're reporting retaliate? Huge problems, and maybe we need to discuss it. Or everybody knows that this is going on. Somebody else will report it. I'm staying out of it. Or maybe it wasn't that bad. It's one experiment. The rest of the experiments all support the same thing. So maybe we're okay. And it's not that bad. Well, to you it might not be, but maybe that small experiment isn't a huge deal in this paper, but that small experiment is huge in another person's mind, in another related area. and that small experiment could send off someone else completely down the wrong path. So you do have an obligation to report something that you think isn't that bad, but you know is questionable. And then lack of confidence in the process. So if you do report, you know there's something wrong, you think it's just going to be whitewashed or the process for dealing with it is inadequate. And that's why you might not want to. All those things, though, have to be dealt with. Authorship, huge trap. And as you start your own laboratory or program in the future, this is really something that lots of people have trouble with. And at Sick Kids, a lot of my time is taken up with solving authorship issues. And it usually comes down to people not communicating at the beginning of a study very well. Who's going to be the lead author? And that may change as the work develops, but to constantly talk about it. Okay, now we've got this new data, this new experiment, this now is taking precedent over everything else in the paper, and Joe was going to be the first author, but now it's definitely going to be Susan. That requires constant discussion. Don't leave it till the paper is being sent off to the journal. Deal with it early on. So I'm going to stop there. There are lots of things that the institution can do to make life easier for students and postdocs. And we can talk about that at another time. But you must have some questions or comments. So please.
I have a question. Is there any evidence that there are more scientific mistakes leading to high impact factor publication rather than, because when sometimes you see papers in science, you see Western blots or whatever that look weird, and if you go to blood, well, you don't see that.
Yeah, so the question is there a link between high impact journals and questionable research practice or fabrication and falsification? And yes, there is, unfortunately, that the journals that have the highest retraction rates are the highest impact journals. It's proportional to the impact factor. So be very careful when you read Nature.
People read them more, or is it because the researchers are trying to do those? That's right. So what is the basis for that? That they come under more scrutiny or the pressure to get into those journals? It's probably both. It's surprising how bad the data is when you sit down and look at it yourself in some high impact papers. So there's all kinds of reasons. There's politics and power and whatever in these high profile journals that can contribute to less than the best science. So there are good papers in Cell too, though.
I think the PI should learn this kind of talk more often because PI play critical role.
Right. So yeah.
It's not student, like
right.
PI is sick,
yeah.
like a student take medicine. So.
Yeah. So the question is, shouldn't the PIs be at this talk more than grad students and postdocs? And every time we give these workshops at Sick Kids for grad students and postdocs, that is the first question is, why aren't the PIs at these, and so I've had to actually start doing this at Sick Kids with PIs, and we had one workshop last June, and 10 people came out of 200.
So I went to the chief of research and said only 10 people came, and she said, "Who are they?" No, she didn't. I'm joking. And she said, "Yeah, I know, it's a problem." So I've taken the show on the road. I go to the program meetings of the different programs within the Institute and give a 20-minute version of this. But you're right. And I don't want to imply anywhere in this presentation today that the problems are the grad students and the postdocs and the technicians, people who are really doing the work. That the problems can come from the PIs as much or more. And as I said, putting pressure on your students to get the results you want is completely unfair and inappropriate, and that's questionable research practice, and if that's going on, it needs to be dealt with. You're right. So in an institution like this, discussing research integrity, questionable research practice has to go on from the top down, and it's a never-ending discussion. So that's the challenge for all institutions, and if I had gone through the third part of this talk, that's what it's about. It is a new environment as we are going forward, as the economy crashes and everything else. The pressure is increasing. It's not going down. And PIs are under enormous pressure to get papers out and get grants funded, and you're under pressure to provide them with the data, and you will be under pressure when you move out of your postdoc and start your own lab. It's really horrendous. I don't think it's just that, though. We're in a different environment today than when I was a graduate student 100 years ago. Yeah. There really is, you're bombarded with advertisements all the time that really are saying it's okay to lie. It's okay to whitewash this lie and make it look acceptable. And that is a cultural change that's gone on in the last 20 years. And so that's hard to counter 100 times a day when you're in the subway reading the advertisements. And then you come to the lab and, they were doing this in the subway advertisements. Maybe we can, treat our data with such disrespect as the advertisements were treating me. There is a cultural component to this that we have to counter. So it really does require awareness and diligence. It's subtle, and doing good research is difficult. Other comments?
Yeah, I just have a quick question. Actually, this is a topic that's actually right now in the United States, because I don't know if you follow politics there, but the Republican Party, they're basically saying that, scientists are scamming the population, right? They're like scientists, reviewing other scientists, so it's like kind of a little mafia group, getting money from them. So what's your response to that, and how would you convince, I guess, the politician that basic science is not a scam?
Yeah, this is a real problem that we are all having to deal with. The International Commission on Climate Change, the International Policy on Climate Change, the problems they got into with emails that were poorly written and worded, and this idea that we all have agendas and we're scamming the public is becoming more prevalent. And as people get fearful, they come up with ridiculous notions, and politicians are leading the pack, certainly in the United States. So what it means is that we have to communicate really, really well. We have to do our work with great diligence. We have to
tell the public what the scientific enterprise is about, how it works. We have to be really forthcoming when something bad goes wrong in our lab or in an institution. We really have to come clean. But you can't convince crazies that what we're doing is worthy and certainly worth public funding. And there are a lot of crazies right now. The political system in the United States the wheels have come off, and we're going to see all kinds of strange things. I mean, there's growing numbers of people who really think that oil is continually being produced in the center of the earth. I mean, you know, and that scientists who say, no, it's not, it was produced millions of years ago, have an agenda to hurt us. So, yeah, it's a really strange world.
I think you brought a very important point about the philosophy of the big picture, which I think is terribly missing. I think it's missing from not even in university. It should be actually ignite much earlier. And it's completely lost down the line. I think this was the main reason why people used to do science, out of curiosity and out of knowing the truth. And right now, the questions are different. We don't want to know the truth, we want to cure cancer. But in fact, I belong to those who like to know the truth. But I have very few people to talk to about it.
Mm-hmm.
And there's no, in science, there's no philosophy introduced at all.
Can you repeat the comment? Or
Yeah, so the comment is the big picture versus maybe what you might say is a utilitarian approach to science.
Which I'm
Yeah.
not against.
No, that's right. We do want to cure or discover ways of treating disease and discovering ways of detecting it early and so on. But that versus the big picture, the philosophical, the excitement of discovery as opposed to coming up with a drug or whatever is I think what you're concerned about. And that if we're treating science as utilitarian, then the vision is gone, and coming up with the truth as opposed to a quick fix to an enzyme pathway. I agree that, and in mentoring, to have this vision of how wonderful the world is and how exciting it is to discover how the cell works or whatever is much more inspiring than just getting, an experiment done so that you can get a high-profile paper, so that you can get more money to do research. That's not inspiring, and that's where the problems will come, because we're not looking for the truth, we're looking for a quick paper. I think that is a problem. It's not the whole story, though.
Sorry, I have a rather provocative question, and so personally, I don't think so. But why should we? What should we care about research ethics if we think that eventually, like in the banking system, there will be a self-regulatory system that makes that if you didn't perform your research properly, in 10 years, you won't have any quotation, or ultimately, everybody will know that it's not true, and then you can look at the long term. Only the good science will survive. Do you understand what
I'm not sure I got it. That you're saying that
good research will survive and bad will fall by the wayside anyway, so we shouldn't really worry.
Yeah, well,
Yeah. Ultimately, that is true, that the stories that are wrong will gradually work their way out of the system and won't survive the test of time, definitely. But that can take a long, long time. And in the interim, a lot of people have gone down the wrong, the cul-de-sac, the dead end, because of that misconduct and have been sent off the track. So if it was just your own program, eventually, you've got a short lifespan, maybe 10 years, and then people are going to ignore you because your work has always turned out to be wrong. But you influence other people, and you take money away from people who are conscientious. So it does matter, because it takes resources to do what you're doing, which is...
Comment on that. I actually spent 3 years looking for a hepatitis B virus receptor that turned out to be a good result. Let's say 3 years of research time. So that's in the pipe.
Yeah.
Culminating in Bazett to actually look at the analyze that fit the data. And that was in the
Yeah. So unfortunately, you were somebody who brought it to the light faster than 10 years. It happened sooner, but somebody wasted 3 years as a result. So, yeah, the truth will come out, but unfortunately, not that quickly.
We're over.
Okay. Yep, definitely gone over.
Yeah.
Uh,
Thank you very much.
I'll stay around if you want to talk. Thanks.